Hi everyone. In this video, we are going to talk about one of the most popular misconceptions about the ASAM criteria. And this one in particular, I have been hearing about since I began in the substance use treatment field. I've been hearing it for over 20 years. So it's a very popular misconception. So I thought today we could talk a little bit about it to help you understand what the ASAM really says. Now, if you've watched our introduction to the ASAM video, then you know that on the very first page of this big ASAM book, it says specifically, the ASAM is not meant to override clinical judgment. It is meant as a guide. It is not meant to be so mechanical or restrictive that you don't have any movement with how you rate a patient's needs or where you end up placing them. So the ASAM as a reference, an assessment tool, and a placement tool is really not trying to categorize people down into such a level that you can't use your clinical judgment when you decide what's the best course of therapy for them. So here, one of the most common misconceptions that I hear is that all of the ASAM levels have to match. If my patient needs a level 2 program, all of the dimensions have to be rated at a level 2. Similarly, this is kind of a misconception that tags along, is to arrive at a proper placement determination, you should average the severity across the dimensions. So for example, if I have 2 dimensions at level 3, 2 dimensions at level 1, and the rest at level 2, then the patient should be recommended to go to level 2. Like we're doing some kind of fancy mathematics to find out where to place our clients. Okay, so reality is neither one of those is true. And it's really, really important for us to understand the proper procedure for using the ASAM criteria to properly assess and place a client. So the process for doing that is that you are taking all of their biopsychosocial information that you gained from them during the assessment. You are organizing that into the 6 dimensions, and then you are rating each dimension for level of risk and recommendation for level of care. Each dimension is probably going to be different. For example, if a client doesn't have much going on, but they're experiencing a lot of withdrawal symptoms, then they might qualify for a higher level of care in dimension 1. But maybe if everything else in their life is going pretty well, maybe their dimension 6 is assessed only at a level 1 recommendation. So you are going to look at the dimension that has the highest risk rating, and that is going to dictate where you place them. So if my client is doing really well overall, but they are going to have to go to withdrawal management services because they've been consistently drinking alcohol, and I have some concerns about maybe some biomedical conditions that could complicate their withdrawal process, then I might go ahead and send them to a withdrawal management program. And that might be a higher level of care. And then when they complete that, then maybe they would step down to a level 2 or even a level 1 care. So in order for a client to qualify to go to residential care at some kind of level 3, or even a more medically based care at a level 4, not all of the dimensions need to say level 3 or level 4, because it may not be true for that individual dimension. I've had people come into my office and be really blunt and honest and say, I have an alcohol problem. I've been drinking every day for the past 20 years, and I can't even sleep through the night without having withdrawal symptoms. So I get up in the middle of the night to drink, but I know I have a problem and I need to stop. And I'm really ready to do whatever you recommend for me. Okay. Now, I haven't given you a lot of information about this client, but I can tell you in Dimension 1 for acute intoxication and withdrawal potential, they're going to need withdrawal management services. And chances are they're going to need withdrawal management where they go and stay there for a while. So something that is over level 3 or even a level 4 type of withdrawal management placement. But if you look at their Dimension 4, they recognize that they have a problem and they're ready to stop. They are probably in the preparation stage of change. So in that dimension, after I take all of that data into account, I might only rate them at needing a level 1 placement of care in that particular dimension. Now, because their Dimension 1 issues are so serious, that dimension is going to dictate where I initially place them. But then once those issues are stabilized, I may move them down to a lower level of care. It will need to be reassessed when they come out of their withdrawal management treatment. They may go into a level 3, 2, or 1, depending on how they present after they go through that process. So I think something that some counselors get really uncomfortable with is this idea that their assessment can change. And we do our best during the initial assessment to get all of the information that we can and to make the best recommendation that is going to keep them safe and address their most important issues. But reality is, if you're doing a really good job, you are assessing a client every single time you have contact with them. It doesn't mean that you're doing all of the forms and all of the write-ups necessarily, although you may periodically need to do that. But it means every time you see them, you're thinking about these 6 dimensions and you're making sure that the level of care you have them at right now still makes sense for them. So the idea behind the ASAM is that it is a structural guide for doing that. Not that we do an initial assessment, we place them, and it's over. It's not over until they are discharged from your program. So until then, we are continuously reassessing to make sure that they're at the right level of care and moving their level of care up or down depending on their needs. I hope that this was a little bit helpful to you. I know it would have been helpful to me had somebody talked to me about it about 15 years ago. So I hope that it was helpful. If you are looking for a more extensive ASAM training, cover to cover, check out our website, pacificcrestclinical.com, and you can see our upcoming training menu. If you enjoyed this video and you want to see more informational videos on the ASAM or meditation, DBT skills, and all of the other informational videos that we offer, then please subscribe and leave comments down below. Thanks for joining me, and I'll see you next time.